Tonight, vindication for two former workers of the Watkins plant. They are getting ACC compensation for injuries relating to dioxin exposure. For years, the people of New Plymouth have been trying to tell anyone who'd listen about the cancers, the birth deformities, the skin diseases they believe were caused by dioxins from the plant. Now at last, what is tantamount to an admission from ACC, there is a problem. Last year, CLOSEUP decided to test former workers who were frustrated that no one was taking their concerns seriously. Neil Hurdson was one of them. He was a chemical process worker and the union rep at Watkins. We also tested Jeanette Hermans. Her husband John worked at IWD from 1965 until 1992 when he died of cancer. Jeanette also has cancer. She believes she too was poisoned by the dioxins. Of all the four we tested, Jeanette's dioxin levels were the highest. Well, tonight both Neil Hurdson and Jeanette Hermans are with us, and they're joined by ACC's corporate medical advisor, Dr. Kevin Morris. Good evening to you all.
Good evening.
Neil, if I can start with you, it's been a long time coming. How many years have you been battling for some official recognition that people were injured, people were hurt?
Well, since 1982, when we first asked the health department to look into our claims that being exposed to the chemicals was affecting the health of the workers. So, since 1982, there was 49 workers back in those days that volunteered to have their health checked and went forward to a survey, but the survey was never carried through, so it was a useless exercise.
You are one of the 6 claimants, I believe. Do you know if your claim is successful? There were six in this initial batch.
I've been told informally that my claim has been accepted partially, and that's about all I know.
Well, Dr. Morris, can you straighten that out?
Yes, Susan, happy to. I can't comment on the specifics of Mr. Hurdson's case, as I don't know the detail, but it is possible. I know when people make claims to ACC that they will claim for a number of conditions, so they might want to indicate that they've had this disease, that disease, a number of things have occurred. Now, a partial acceptance would suggest that some of those conditions we have said yes, we agree that cover is available, and some of the other conditions we may have said, well, no, we don't agree that they were caused by exposure.
Well, does that mean that Neil is one of these 2 Taranaki people who've been covered, or not?
I don't have the details of the names of the people, but I do know, as you have said, there are 6 people that have been through the cover process, and yes,
2 have been accepted.
2 have been accepted.
Isn't it bizarre that you've put this out in public and not actually told the individuals concerned, though?
My knowledge is that they have been told, and I'm surprised a little bit to hear that he's been told informally. Normally there's a letter which has gone out, and I expect that he would have received that letter.
So Neil Hurdson, no letter, nothing in the post?
If Mr. Hudson's any doubt about that, then I think he should contact the branch manager at New Plymouth, and they can certainly clarify that completely for him.
So nothing, Neil, nothing for you?
I had a discussion with people at the New Plymouth branch, and they explained to me that there'd been a partial acceptance and they were going away to get some more clarification, in actual fact.
Have you had any indication of what sort of support or what sort of help or what sort of dollar value you will get?
No, only perhaps the compensation in the way of the number of doctors' fees that I've had to pay over the years for the continuing ill health.
Well, let's put this back to Kevin Morris again. The claims the 2 you have accepted, what will they get?
Susan, any person that gets covered by ACC has access to the whole range of entitlements which are available under ACC. They can include, for example, if because of your covered condition you're unable to work, that weekly compensation could be paid. That's replacement of wages. If you need medical treatment, medical visits, pharmaceuticals, that whole range of treatment issues, they can be paid. If you need issues to help with social or vocational rehabilitation, those can be paid.
Sure. Are we looking at our previous medical bills, and are we looking at a lump sum payment for any of these people?
The previous medical bills certainly can be looked at. Normally there's a date of cover applies from. And
well, these people have been waiting for 23 years, haven't they?
Certainly, and of course we've only received this claim, as I understand it, all these group of claims came forward at the end of last year, so we've only known about them since September or so last year.
Jeanette Hermans, if I can bring you in here, I mean, you haven't claimed because you didn't work there. Do you feel, though, any sense of sort of satisfaction or vindication in this from ACC?
Yes, but I think that they should consider the families that have been affected by it. And I didn't even work there, but just through my husband.
I guess, Kevin, you're going to tell me that's not your department, is it? Not the families, you're simply concerned with the workers.
Yes, well, as you realise, Susan, ACC is prescribed by legislation and we can only do what's available under the law. And unfortunately, yes, only workers are covered in terms of diseases from exposures like these.
You talk about the range of conditions from skin conditions to cancers. The two that were accepted, can you tell me the conditions they had that were accepted?
No, I don't have that detail,
You
Susan.
can't tell me that sort of a detail. There are another 5 workers being tested next month. How many more after that, do you know?
To my knowledge, it's just a total of 12 that have come through into the cover process. We had more than that in terms of inquiries, but only 12 people have come forward and lodged claims.
Neil Hudson, you talked about 49 workers back 23 years ago putting themselves forward. Do you know how many of those workers are still alive?
No, I don't know exactly, Susan, but I do know that off the top of my head, I believe that 9 of those workers died of cancers that could have been caused through working with chemicals. There's many other of those workers that have had illnesses, and the 49 were only a small sample of the total workforce.
An official acceptance, I guess. Are you looking now for some sort of wider inquiry?
Yes, I think there should be a wider inquiry. There's thousands of workers who have worked and been exposed to chemicals at IWD, and there is scientific proof now that the chance of dying from cancers and other diseases are much higher if you in fact worked and were exposed to the chemicals that we were exposed to.
Neil Hudson, when you find out, can you let us know tomorrow whether you've got cover or not? We'd be interested to know. Jeanette Hermans and Kevin Morris, thank you all for your time this evening.